Good morning. In 2015, the Alliance's Board of Directors established the Health Transformation Awards program to recognize people and organizations that align themselves with the Alliance's mission of moving healthcare forward by reducing costs, improving quality of care, and engaging individuals in their health. So today I'm at Merrill Steel with Matt Ohrt, who's the VP of HR and Medical Services. Matt has been resolute in his dedication to his employees, their company, and their health, and he's more than deserving of this award. So Matt has worked to improve the quality and accessibility of health for his nearly 500 employees and their families by, among other things, building an on-site clinic. The first iteration of this on-site clinic he quite literally built with his own hands. Next, Matt realized that many of the healthcare costs for his employees and their families came from services like MRIs, ultrasounds, and X-rays. What he did was quite unique. He purchased an ambulance that he turned into a mobile health clinic that makes house calls to employees' homes. This mobile unit provides accessibility to healthcare services to Merrill Steel employees and their families, as well as saving both Merrill Steel and its employees a lot of healthcare costs by avoiding urgent care and ER visits. Matt has become a leader in healthcare and in his community by sharing his knowledge and his advice with many other employers in northern Wisconsin. And the Alliance Board of Directors is very proud to present him today with this award. I will now invite Matt to join us here on the stage to receive this award.
Yeah, I'm very pleased to receive this award and very humbled that I was the one chosen. But I'm a big believer that when you achieve something, you never achieve it on your own. And there are many people that have been a big part of this achievement that have worked with me, but we did not know how this was going to go. So looking at owners and saying that we're going to have $100,000, $200,000, or $300,000 investment and not knowing how that was going to go was kind of risky, and it was a little scary. Turned out that we had our return on investment very quickly, but you don't know those kinds of things going in. So that trust and that support has been really big on our journey of healthcare. Our clinic provides many services, and I would say above and beyond even the typical big system clinics. We have MRI that can be called, that can be there within a couple days. We have a mobile clinic that will travel to the homes. We have mobile X-ray as part of that. We have ultrasound, we have casting ability. We can do lab work at far cheaper than going through the systems. We can also prescribe. So if someone needs an ongoing medication, we can do that, and they don't have to wait 3 months for an appointment. Or if you want to renew a prescription, you don't have to pay a doctor's visit, which can be several $100s just to get that prescription renewed. Before we started this, we were averaging about the same as the national average of 9% increases per year, which is what the national average is. And so we were doing the same. And since we started calculating that projected graph of where we would have been had we done nothing versus what we've done, we are over now $4 million in savings since January of 2016. Wisconsin is the second highest cost state for healthcare. And so this is prime ground, and any seeds that you can plant and anything you can do, it's an easier win in Wisconsin, if you will, and it's a much more necessary action than it might be, say, in Michigan, that's averaging about 150% of Medicare, where Wisconsin's averaging 400+% of Medicare. So it's been very damaging for our community and our families to be overcharged on things and then to not have a way to pay for those, as our benefit plans in many cases have eroded over the years. That deductibles can be in the 6 or 8 or 10,000 range, and most families don't have that kind of savings. So there's a lot more in this even than just helping Merrill Steel employees and their families, that if we can join together and make healthcare better in Wisconsin, we can do a lot more good there.